Now, the second area that we spent quite a bit of time on today was aged care, and the work that we reported to you last time will be coming back to the National Cabinet, and the further work that is being done on preparedness. There was an agreement to how an emergency response operations centre would be established in other jurisdictions, modelled on what is being done in the experience in Victoria. It was noted that there are existing arrangements with states and territories currently which are dealing with the demands as they're currently presenting in the states and territory, and there was no need at this point to move any of those other states and territories to the footing we have in Victoria with the scale of those operations. So that is acknowledged, and I particularly acknowledge the work that has been done in Queensland in that respect, and in New South Wales, where we've been working closely with them, and those programs are good. But if either the Commonwealth or the state or territory believes that we need to initiate taking that level of cooperation to a whole new level through an aged care response centre, then either jurisdiction can initiate that process, and that would be done on a bilateral basis. Now, to support those plans, today I'm announcing that the Commonwealth will be investing a further $171 million to extend our aged care response package and support the announcement that we have made. That takes our total investment in aged care throughout this pandemic to more than $1 billion. The government will be providing $9.1 million, in particular for funding to support the operation of the further operations of the Victorian Aged Care Response Centre. We're investing an additional $103.4 million in the already announced aged care COVID-19 preparedness measures. That includes workforce measures, activating National Emergency Call Centre surge capabilities for communications, particularly with families, funding compressed training programs for new workers, covering quarantine costs for interstate staff deployed, and strengthening the capacity to support aged care residents and their families with the grief and trauma associated with the COVID-19 outbreak. Now, these are all things that we've already been doing. We're going to need to be doing them for much longer, and further resource and support will be necessary. There's also a further $50.6 million that will be provided to extend funding for the second instalment of the aged care workforce retention payment that is due to be paid in September. And we're also providing an additional $9 million to the Aged Care Quality and Safety Commission to support their ongoing regulation of aged care. And Professor Kelly will talk a bit more about issues regarding assessments being made in aged care facilities. I was pleased to learn this morning, getting my report from Joe Buffoni, who heads up the Aged Care Response Centre, from the day 40 facilities being visited each and every day in Victoria, and then that will progress into other states and territories.